Welcome everyone to Wellness Spring. Today I'm super excited because my guest is Dr. Todes, who is actually my periodontist, and I was blessed to meet him over 20 years ago when I was actually a sports massage therapist, and I got asked to give a talk to a group of dentists and oral specialists, and I was fortunate to meet him there. So yeah, without further ado, I'll dive into the bio. So Dr. Todes graduated with a BDS from the University of Witwatersrand in 1988 in Johannesburg, South Africa. He completed his specialty training in 1994, attaining his Master of Dentistry in the field of periodontics and oral medicine. He is a fellow of the Royal Australasian College of Dental Surgeons in the specialty stream of periodontics, and he's currently working in a private practice in Macquarie Street, Sydney. Very prestigious area, and his office is amazing and his staff is amazing, and he is super busy. It's like 7:30 in the morning now, and he's having this chat with me before he starts his case, and it's actually a day off. But with all the lockdowns and COVID and various other problems, he's had to do a lot of catch-up work. So he's working super busy. And I know from past experience, when I seen him as a client 20 years ago, he was just as busy then. So his his speciality is periodontal disease and implant dentistry, and he has a special interest, I believe, in aesthetic and functional soft tissue management of gingival recession around dental implants. So before we delve into that, could you please tell our listeners about your background, like where you grew up, your family, is anybody else a dentist, your siblings, just so they can get a feel of you, because anybody can read up about periodontal and what it is, but we'd like to get to the nitty-gritty and find out who you are.
Very well, thank you very much for inviting me and for arranging this this morning. Yes, I'm originally from South Africa, been in Australia for the last 25 odd years. I grew up on a farm. My family were all farmers. My grandparents were from Eastern Europe and from the UK, so that's my mix. Grew up on the farm, went to boarding school, did my primary and secondary education in Johannesburg, followed by my dental degree. And at that stage, we had to do national service in South Africa, so I was sent to the Navy as a dentist. Spent my time as a dentist in the Navy, and after completing that, I then specialised, was in practice in Johannesburg for a few years, and then immigrated to Australia and have been in the same practice ever since.
Wow, I didn't know that about you. Growing up on a farm, what was that like?
Oh, it was terrific. Freedom. I mean, be able to ride horses from age 5, do all the things, hunting and fishing and being in the outdoors was terrific. And that was really my first love, is that I wanted a farm. And when I went to my dad, he said, no, go and study something, whatever you do, and then you can farm. And I went and I did dentistry, and I came back and I said, I'm now ready to farm. And he said, well, go and specialise and then come back.
Wow.
And that was the end.
Wow, he was a very good influencer on you then. And what was it like in the military? I didn't realize you had to do compulsory military.
For us, it was really very straightforward, and we worked in our professions, and going into the military at about 23, 24 years of age was a different experience to people having just going in after school. So we were treated differently. We all did officers course, so a very simplified, very abridged version. So it was relatively straightforward, and yeah, we had a good time.
Oh, fantastic. And what about your children? You know, what advice have you given them?
Really just how important education is, and really that's really our focus, my wife and myself. My wife's a psychoanalyst, and we've both been through it, and that's really our drive. But they've got to do what they want to and what their passion is, and they've got to move forward with that.
Yeah, that's great. No, I was curious because your father wouldn't let you work on the land, because at the moment Brian and I are travelling around Australia looking for land, because it's always been my wish to have land in France and land here to do retreats. And I just love being in nature and, you know, having that freedom. But, you know, with the way the world is at the moment and different restrictions, I was just wondering, because a lot of parents want their children to follow in their footsteps. So I was just wondering what you'd advise them. But it's good that you're giving that freedom to choose what they really want to do. So could you tell us, because I know a lot of the listeners will be thinking, what is periodontist? You know, can you tell us what the work it is, and why people come to you?
Sure. So periodontics, so peri means around, odont, the tooth. So we really deal with all the structures around the teeth, about the soft tissue and the bone support. Our primary role is dealing with periodontal disease, which does affect a large percentage of the population. Roughly about 47% of the population do struggle with this disease to some degree. So that's our major drive, is really dealing and treating periodontal disease, and then really trying to maintain the people in a state of remission or health. We have other functions as well, and that's dealing with soft tissue defects around the teeth, and both around implants. We're involved in implant surgery as well, and all the adjunct procedures related to that.
And how do people know? Because I was horrified when Dr. Jerry Moses, who was treating me at the time, told me that I needed to come and see you, because I was religiously seeing dentists, which I've always done since I was a child, because I grew up with ingrowing teeth, impacted teeth, crooked teeth. So I was like back and forth the dentist, having various work done on my teeth. So I was horrified because I wasn't in pain. I hadn't noticed any bleeding gums. So how would one know that you need to see a periodontist?
Sure. So I think the first thing is really certain signs, for example, bleeding on brushing. That's a big sign. Gaps developing between one's teeth, increased sensitivity around the teeth, difficulty in chewing. Those would be the initial signs. I think it's also prudent to speak to one's family, to one's parents, and find out whether there's been any familial history of periodontal disease, etc. But the biggest thing is really noticing bleeding on brushing, a bad taste developing, bad breath, gaps between the teeth, etc.
Right.
Movement of would be the initial signs.
And do you have to be referred by a dentist, or can someone just ring you up and book in?
No, generally one can just ring up and book in. We do like to be able to then communicate with the patient's restorative dentist, because there's certain things that we would like them to do. And in essence, it's really co-management in keeping someone dentally healthy. So cooperation between the dentist and periodontist and the hygienist or the oral health therapist is really important, and working as a team to keep the patient really dentally healthy and in turn systemically healthy, because it does contribute to one's general health.
Great. And I know you see children as well. What would they be presenting with the same symptoms, or what would you be doing? Because obviously they're going to have baby teeth or milk teeth or whatever they call them today.
Sure. So I think that's a very good question, is that kids generally, there are a very small percentage of kids that are at risk of a particular type of periodontal disease, but not very common. Most kids we see are for elective procedures. For example, patients undergoing orthodontic treatment where they have impacted teeth, where we need to surgically expose them to facilitate the orthodontics, or anchor plates, where when I had orthodontics as a teenager, we used to wear headgear, all those big frames around us to achieve anchorage. But nowadays, orthodontics are so advanced that we can use small bone plates that we place within the jaw itself to help with anchorage. So we're involved with those procedures. So that's majority of the procedures that we do with kids, as opposed to disease in adults.
Wow. Oh my God. Did you get a lot of bullying wearing all that headgear?
Yes. Compliance was always difficult.
And I was chatting to a friend in America, because I didn't have my orthodontic treatment until I was in my 30s, so probably a lot younger, because I know a lot of children start when they're about 13. But I know Dr. Derek Mahoney, an orthodontist here in Sydney, he recommends seeing children from 7 years old, and he sees extractions as the last resort. And he gets people, because a lot of people are mouth breathers, and they're usually the ones who have the symptoms I described, like with overcrowding and jaw badly aligned, so receding jaw and high roof and high palate, and suffer with sinusitis or bronchitis and respiratory disease. So do you notice that a lot of mouth breathers come to you, for example?
Yes, so within our speciality, mouth breathing, the biggest sign that we see with that is really some marginal inflammation, particularly of the anterior dentition, the soft tissue around that, because as mouth breathers, as they breathe in air, it dries out that anterior part of the mouth, and dental plaques adheres to the teeth a lot easier, so they end up with marginal inflammation. In a lot of mouth breathers, you see a distinct difference between the anterior dentition, the soft tissue around the anterior dentition, versus the posterior dentition. And that really, from a periodontal point of view, is our contribution with regard to mouth breathing.
Right. Do you then give them advice on how to nasal breathe?
No, I don't.
Okay. Well, maybe I can give you some tips. Because I teach a lot of children and adults the Buteyko method, which is scientifically been proven to help people to switch from dysfunctional breathing, as we call it, the oral breathing, to nasal breathing. I was talking recently to a friend in America about our chat, And she was telling me that when she took her child to a periodontist, they actually showed a model of the teeth and explained to the child what they were going to be doing. Because I know over the years when I've been to different people, it was quite, alarming when you hear them poking your teeth. I know you're probing and saying, number 6, this, that, or the other, number 7, pocket bleeding, blah, blah, blah. Do you have a model that you show to children and adults that, the shape of the teeth and how the gums sink and how the bone can be exposed and the nerves? Or what would be a typical consultation for you?
Sure. So how it works is when a patient would come in, we would take really a detailed history, what the patient's concerns were, whether the patient was having any difficulties from their perspective. We get a familial history, a medical history. We would then do a clinical examination. And following that, I would really go through in detail with them diagrammatically. We have software programs today that are very descriptive, and I'd run through it with them exactly what we did, what the indices meant, how we interpret them, and that really brings the patient on board as they're part of the diagnostics and they're with us. And I think that's modern practice, is that we need to bring the patient on board with exactly what we're attempting to do, what our thought processes are, and then ultimately when we plan the treatment is really for the patient to understand why they're coming in and what each appointment involves and what we are trying to achieve, what our objectives are. Also important to actually show them in their own mouths what's happening and to point it out to them. As I said, a very personal thing, and they need to see that.
Yeah,
so a combination of.
I know, I was very happy with your service, and obviously with my bone loss and, with the gums receding, it was good that you explained to me with my large pockets why I needed to have the deep cleaning every 4 months, with a dentist twice and then with you. So it's like long-term planning as well. Can you explain about the work with the bone grafts and the implants and what you do for that and why it's needed, please?
Sure. So I think that we need to really understand what periodontal disease is to start, and what we call the pathogenesis, which really just means the process of what's happening. So we all, from the day we're born, all harbor bacteria in our mouths, and these bacteria are resident on the tongue, the floor of the mouth, the tonsil area, etc. And in a percentage of patients that carry these particular group of bacteria that causes periodontal disease, when they accumulate around the teeth and they are not removed, patients unable to remove it, patients' home care is not appropriate. And when they build up around the teeth beyond and go below the gum level and build beyond the threshold, for that individual patient, the body responds with an overexuberant inflammatory and immune response. And that inflammatory response starts to destroy the attachment. That's both the soft tissue attachment and the bone attachment. And that's when we start to see these pockets develop. When the bone is lost, there's certain patterns of bone loss, both horizontal and vertical or angular bone loss. And in areas of angular bone loss, or in some of the back teeth which are multi-rooted, when they start to lose bone in between the roots, called the interradicular area, they create a certain morphology of defect. And a lot of the time, these defects are conducive to a reconstructive approach. And nowadays, we use a number of biologics to aid us in reconstructing those areas. For example, there's a product called Emdogain, which really mimics the normal development of teeth and the periodontal structures. So we use that in attempting to regenerate that lost bone. And that's really where the bone grafts, those modalities fit into the management of periodontal disease.
Wow. I know you're always studying and doing research and you lecture everywhere, so it's great that you are able to pass on your wisdom to the younger dentists and the older ones as well. So very grateful for that. What type of things do you lecture about in general?
Well, I have a passion in soft tissue management, so I like to lecture on that and pass that information on. So that's predominantly what I enjoy about or teaching. And a microsurgery, which really where modern periodontics is at the moment.
Fantastic. And besides having gum disease, as you know, I work a lot with women. Can hormones, for example, affect your gums, or any other things affect your gums?
Most definitely. So with women, with estrogen and progesterone changing at different times, and for example during pregnancy, etc., we definitely do see that certain people have certain heightened reactions at those times, because we find that on the soft tissues, the gingival tissues, there's certain receptor sites, and where estrogen and progesterone has effect, and that can modify or exacerbate an underlying condition. And that really is where nowadays we know systemic disease and periodontal disease are interlinked. For example, diabetes and periodontal disease is a double-edged sword, whereby we know that the periodontal condition is not well managed. People do struggle a little bit more getting their diabetic situation under control, and in patients where the diabetic control is poor, we do see more of a struggle to control periodontal disease. It definitely links to atherosclerosis and periodontal disease. We see common entities with inflammation and damage to what we call the endothelial cells, which are the cells lining the blood vessels. And there's been some documentation with preterm low birth weight and uncontrolled periodontal disease, rheumatoid arthritis and periodontal disease, certain respiratory conditions and periodontal disease. So there's definitely a link. And the issue with periodontal disease is that it does increase the inflammatory burden to the patient. So the inflammatory markers and that are heightened. So in essence, really, it's a matter of controlling the disease, reducing inflammation.
Right, thank you. And is there anything we can do to prevent periodontal disease? I know one time in France, a periodontist told me I'd been overbrushing, or thought I might have been overbrushing.
Sure. So in essence, there's really two things that every individual should be doing, and that's brushing at least every 12 hours. And with majority teeth in place, let's say, excluding the wisdom teeth, let's say 28 teeth, one should be spending at least 2 minutes per cycle in brushing, and also then interdental cleaning, and whether that's using interdental brushes, using dental floss, interdental sticks, but some aid. And that's really the most important aspect. And as long as a patient, from a hygiene point of view, is doing those two things, That's really the most important. Mouth rinses have very limited benefit as they don't penetrate into the tissues, etc. All the other adjuncts like water jets and water picks and air flosses are okay as adjuncts, but don't replace the primary aids, which is the floss, interdental brushes, and just the conventional brushing, where the one's using motorized toothbrush or a manual toothbrush. Sure, overbrushing is a problem, as you mentioned, and care needs to be taken that the appropriate technique is used and in getting the job done without damaging the tissues.
Yeah, I think what he probably meant I was too aggressive, because he also asked me if I ate crusty bread, because the bread can cut into the gums as well.
Yes, so there are certain conditions as well in the mouth that make one more susceptible. Patients that suffer from oral lichen planus, different oral medicine conditions that do make the tissues a little bit more friable. That just means a little bit more delicate, and they're more susceptible then to trauma.
Great. Well, I want to thank you for all your wonderful advice, and I know you have to rush off to surgery, so I'll put all your details here, and maybe we can talk again down the track, because I still have a long list of questions to ask you. So thank you so much, dear Dr. Kevin Todes, for your precious time today and your wonderful words of wisdom.
Thank you so much for having me. I really enjoyed the talk. Happy to come back and talk at any stage. So thank you again for inviting me.
Great, thank you.
Okay, take care.
Thank
Bye-bye.
you. Bye. Thank you.